Hello and welcome to Lok Talks. This is Dr. Lokesh Bhatia. Today I'll be talking to you about some important topic which is fall prevention in healthcare. Based on 6th International Patient Safety Goal, this is the talk I'm going to talk to you about, which is also called IPSG 6. So let's understand the background of this talk today. Falls are one of the leading causes of injury, especially in hospitals, and the 6th International Patient Safety Goal deals with this particular topic. It focuses specifically on reducing the risk of patient harm resulting from falls, and this goal aims to improve the patient safety by ensuring that the hospitals implement strategies to minimize the fall risks. Let's break down and explore why the fall prevention is critical and how we can effectively implement in our healthcare settings. So, understanding the 6th IPSG, to begin with, let's understand what the 6th IPSG entails. The International Patient Safety Goals were established by the Joint Commission International, which is a body which recognizes hospitals to address a common patient safety issues, which is worldwide a problem. The 6th goal focuses on fall prevention and aims to reduce the risk of patient harm resulting from falls. The falls can have serious consequences, especially in vulnerable populations such as the elderly, post-surgical patients who are still under the effect of anesthesia, or those with mobility impairments. The goal is not just about preventing falls, but about minimizing the injuries when the falls occur. Why fall prevention is critical in any healthcare setting? Now let's talk about why this is so critical. Falls in healthcare settings can lead to, number one, injuries. My concern is definitely with this particular thing, and these ranges from minor bruises to serious fractures, head injuries, or even death. Number two, to increased hospital stay. A fall can prolong a patient's hospital stay due to the need for additional treatment and further rehabilitation, and patient indoor care may be prolonged. Number three, financial burden, both on the healthcare system and the patients, with the added costs for the treatments. Surgeries may be required and the extended care may be required. Fourth is psychological effects. Patients may lose confidence and develop a fear of falling, again affecting their ability and overall health. Legal implications. Fifth is legal implications. The hospitals and healthcare professionals are at risk of legal actions if the falls occur due to negligence. So, therefore, fall prevention is not just about the safety, it's about maintaining the dignity, trust, and well-being of our patients. So, let's understand about the risk factors for the falls. Understanding the factors that increases the fall risk is crucial in prevention. Some of the common risk factors I'll be talking about, which includes age. Older adults are more prone to falls due to weakened muscles, poor balance, and slower reflexes are there in old age patients. Number two is the medications. Certain drugs like sedatives or antihypertensives can affect balance and coordination of the patient can get affected. Number 3, post-operative status. Patients recovering from surgeries, especially orthopedic surgeries, are at higher risks. Number 4, cognitive impairments can happen. Dementia, delirium, or confusion can lead to impatience, which are resulting in unsafe actions. 5th is environmental factors. Cluttered rooms, wet floors, poor lighting, or uneven surfaces can all increase the chances of a fall. By assessing these risks and these risk factors, we can develop tailored strategies to protect our patients. Now, let's understand something to how these strategies can be more effective for preventing the falls in healthcare settings. Number 1, patients assessment and screening the patients. Conduct a fall risk assessment for all the patients upon admission. Regularly reassess the high risk patients, especially after changes in the medications or the treatments. Number 2, the patient and family education. Educate patients and families about fall risks, and prevention measures are very important for them to understand. Encourage family members to assist or monitor patients, especially in high risk cases. Number 3, environmental factors needs to be considered and they needs to be modified. Modification of environmental factors. Ensure the patient's environment is safe by eliminating trip hazards like the loose cables or the clutters around. So install the grab bars in the bathrooms and by bedsides. Maintain adequate lightings, especially at night. Number 4, proper use of assistive devices. Ensure the patients have access to walkers, canes, or the mobility aids, the walking aids when needed. Train patients and staff in the correct usage of these devices to prevent improper handling. 5th one is bed and chair alarms. For high risk patients, use bed or chair alarms that alert the staff and the attendant if the patient is trying to get up without assistance. 6th, footwear or clothing. Encourage the patients to wear non-slip footwears and ensure the clothing is fitted to avoid tripping hazards. 7th, safe patient handling. Train the staff in proper patient handling techniques to assist the patients with limited mobility and without causing any injury. Use mechanical lifts if needed to reduce the risk of patients' falls during transfers. 8th point is the medication reviews. Review the patient's medications regularly and more frequently, particularly in high-risk patients, to identify any of that may increase the risk of falls, such as sedatives, medications for high blood pressure that can certainly lower the blood pressure. That has to be observed. Adjust the dosages or the switch medications when necessary. 9th is post-fall protocol. If a patient does fall, have a clear protocol in place for assessment, treatment and review. Analyze the falls to identify any preventable causes and implement corrective measures to avoid future incidents to happen. So, the role of a healthcare workers is very, very important. So, healthcare workers play a very pivotal role in fall prevention as nurses, doctors, and caregivers. We need to remain vigilant, especially with high risk patients. Communicate effectively within the care team to ensure the fall prevention measures are in place and being followed. Use tools such as the fall risk assessment scale and follow the hospital's protocols strictly. By fostering a culture of safety where fall prevention is a part of our daily practice, we not only reduce the risk and reduce the incidence of falls but also enhance overall patient care and satisfaction. So, let's conclude what I'm talking about. In conclusion, fall prevention is a collective responsibility in healthcare. By understanding the risks, implementing the effective strategies, and ensuring ongoing staff training and awareness, we can significantly reduce the occurrence of falls and improve the safety and quality of care for our patients. Remember, the falls prevention is not just a policy, an essential part of compassionate, high quality healthcare. Let's work together to ensure our patients stay safe and secure while in our care. Thank you very much. Bye-bye. See you in next video. Stay connected and stay tuned to Lok Talks. I have also published a proper fall prevention playlist, which was much more being talked in during lockdown period. That was all relating to how to prevent domestic falls. So one can watch all those videos as well in that fall prevention playlist. Thank you very much. Bye-bye. See you in next video. Don't forget to share with all your doctor friends, share with all the hospital owners, share with all the healthcare providers too. Thank you very much. See you in next video.